I'm very fortunate to work at a sports medicine physical therapy practice that has multidisciplinary professionals all under one roof. And I'm the director of sports concussion specialists. We've implemented concussion programs at 6 of our physical therapy practices. And I work as the coordinator, navigator of the program. So my biggest role, aside from the community outreach that we do, is to make sure that all of the clinicians that are involved with the care of our athletes coming through concussion clinic understand what we're using, whether it's the equipment that we're using, whether it's impact, our treatment plans, our plans of care, who's doing what, and making sure that we're all on the same page when it comes to what the expected outcome is for this athlete or this patient. And many of the patients that we see are protracted recovery folks. So, there's just been a tremendous learning curve for me as an athletic trainer to understand what these other allied health professionals do. And this is one of the areas that I'm really excited about with regard to the NATA and its interaction with impact, because in order to really use impact correctly, you've got to stay current. And we're learning things now as athletic trainers and implementing them in our clinics. Issues with healing. What's the reason for the protracted recovery issues? So 4 or 5 years ago, most athletic trainers had no idea what a visual or vestibular problem was. Our neuro background was just very limited, because if you look at our curriculum, it's emergent care, it's orthopedic based, because that's traditional athletic training. Now, as we see this field emerging, and concussion is going to be a tremendous field for athletic trainers moving forward. I see it as a wonderful opportunity for folks that really like to get in and work in a multidisciplinary environment. So my situation is probably a little bit unique in that I'm not at a traditional school site or at a university, but I interact with all those folks. And we also have been providers for Major League Baseball. We see a lot of NFL players that come through, a lot of elite athletes. And at the first part of our practice a few years ago was pretty much limited to protracted recovery and people that weren't getting better. And we've worked really hard to get out into the community to educate our athletic trainer partners about ways that they can help get their athletes back quicker. And part of it is understanding that there's a role there for the neuropsychologist or the neuro-optometrist or the physical therapist that's cross-trained in not only orthopedics, but also understands the comorbidities involved between orthopedic issues, visual and vestibular problems, and how it relates to that 10 or 20% of the population that is going to have protracted recovery, that is going to struggle, and oh, by the way, are not going to do very well in school. That's the whole reason they're in high school or they're in college. We want to get them back to school, back to a positive learning situation. So athletic trainers are trying to do that. It's a difficult management job for them all by themselves at the school site, because they have so many athletes to look after. And I've been there, I understand their plight, and I think it's really important that athletic trainers do seek out, whether it's a physician's office or hospitals. There's a lot of emerging concussion clinics around the country, and fortunately most of them use impact, which is great. So now we can build on a database, and that's the other really important part that we use with our practice. We can treat a patient at our practice in Thousand Oaks or Moore Park and look at their data in Newport Beach and pull in different healthcare providers to help us make decisions about the health and welfare, the progress, where we're going to go with that patient moving forward to get them better. And it's nice to be able to go right on the website and access it that way.
Don't miss out. Click to subscribe to our channel and learn more about concussion care by watching our next video.